What antibody test is most likely to be positive? ANCA, anticardiolipin, anticentromere, antiglomerular basement membrane, antimitochondrial. A 45-year-old woman presented with right flank pain. She had a 4-year history of hypertension and progressive cognitive impairment. On examination, she had livedo reticularis and tenderness in the right flank. Her BP was 185 over 105 mmHg. Urine analysis showed blood 3+ and protein 1+. Hemoglobin 129, WBC 8.7, platelet count 83, serum creatinine 106. What antibody test is most likely to be positive?
This patient has presented with pain and tenderness in the right flank, hypertension and progressive cognitive impairment, and livedo reticularis. Laboratory investigations are showing the evidence of thrombocytopenia with normal serum creatinine level. So the most likely underlying diagnosis is the renal vein thrombosis. Renal vein thrombosis is most commonly associated as a complication of nephrotic syndrome or in association with the antiphospholipid antibody syndrome. The absence of nephrotic range proteinuria and the presence of hypertension and massive hematuria is excluding the nephrotic syndrome. So the underlying features of renal vein thrombosis is most likely to be associated with antiphospholipid antibody syndrome. And APAS is associated with anticardiolipin antibody. ANCA is most likely to be positive in ANCA-associated vasculitis. C ANCA for GPA, granulomatosis with polyangiitis, also known as Wegener's granulomatosis. P ANCA for MPA, microscopic polyangiitis. Anticentromere antibody would be positive in limited cutaneous systemic sclerosis, meaning patient coming up with the features of CREST. C for calcinosis, R for Raynaud's phenomenon, E for esophageal dysmotility, S for sclerodactyly, T for telangiectasia. Anti-GBM antibody would be positive in anti-GBM disease, also known as the GPS, good posture syndrome. And anti-mitochondrial antibody is most likely to be positive in primary biliary cholangitis. So based on our diagnosis of antiphospholipid antibody syndrome leading to renal vein thrombosis, the most likely antibody to be positive would be anticardiolipin antibody. She has antiphospholipid syndrome. The livedo reticularis, cognition problems, and loin pain are a result of thrombosis. This patient likely has renal vein thrombosis accounting for loin pain and dipstick abnormalities. Anticentromere is associated with scleroderma, antiglomerular basement membrane with anti-GBM disease, anti-mitochondrial with primary biliary cirrhosis, and ANCA with ANCA vasculitis. The immediate management in a patient with antiphospholipid antibody syndrome would be the anticoagulation with the help of low molecular weight heparin.